I think that the healthcare system is very effective taking care of acute illness. I think we have a lot of systems in place to take care of chronic illness as well, and people who are engaged and who regularly follow up and have a good understanding of their medical issues do very well managing their heart disease or their diabetes. We have a number of medications and interventions that really can give them good quality of health. The problem is those people who aren't engaged, who may not follow up regularly, where there's social barriers, financial barriers, maybe they just never made a connection with a primary care doctor. And if that chronically ill patient doesn't come see the PCP, they're off our radar. And until they're in the emergency room and we get a call several months later, we've done nothing to manage them. So I think the way primary care is going is to assume care for a panel of patients rather than really just being reimbursed for the visits that we see here in the office. And that's forcing us to shift our emphasis to making phone calls, coordinating visits with nurse practitioners so we have more time for education, calling people who are being discharged from the hospital to make sure they got their meds and got their follow-up set up. So managing patients even when they're not right here in front of us. And I think that's where primary care is heading.
So what do you think that means for the patient? Like, how will this change? If I were a patient, how will this change help me?
I'm hoping that people will really come back to viewing their primary care doctor as their access point. There was that whole period of time when primary care doctors were viewed as gatekeepers with managed care. We're coming back to managed care, but instead of individual doctors being responsible for patients, it's the system as a whole. So Mass General that's taking responsibility for managing the patients, whether it's primary care or specialists. And I'm hoping that patients really feel that they can then go to primary care and have that primary care doctor really try to fit them in for urgent visits, coordinate care so that they're using an EMR system to communicate with the variety of specialists that are involved in their care, and really spending the time to educate them and engage them.
And they'll probably also feel like, hopefully they'll feel like they have easier access to you through email or through quick phone calls or things, right? Rather than having to come in, set up an appointment, come in, and...
So when you no longer get reimbursed only for the visits, and there's a certain portion that's to the care of patients, it might be advantageous if your schedule is full to spend, rather than staying later and keeping staff there to try to fit that person in or send them to the emergency room, to get on the phone or to hire the extra nurse to talk to that patient to figure out, can we treat that person by phone, and if they're not better, we'll fit them in within a day or two. The patient portal makes that communication much better, so people will be reporting their blood sugars to me as we make a change, and rather than waiting 3 months for a follow-up appointment, they can let me know in a week what their morning sugars are, and I can tweak it. And we can make adjustments. Same thing with blood pressure, weights for people with heart failure. Even the question of, do I need to come in for this? Or what do you think about this? Is perfect for patient portal so that you can confidentially email the office. The difference for primary care is that it really will be team-based care. So it'll be coordinating specialists, but even within this office, I am hiring LPNs, I'm hiring RNs and NPs, and actually carving out time for them to be involved in education. So if I'm seeing someone and they have a clot and they need to be started on a blood thinning medicine, I can walk out, have my nurse come in and instruct them on how to do the injections and side effects. So I think that people will see that their primary care office manages as a team better. And that would extend what I can do. Sometimes it's going to be a little area that is our like for group visits, so it's extended of the waiting area, but we can actually
close the doors.
You can close the doors and have a meeting. It facilitates getting the blood drawn right away, because one of the drawbacks is people don't come back for the blood work they're supposed to do.
Lab, you have to go to the lab, or
Right.
So you have it right here in-house. That's great.
And it goes to MGH by courier service, and so it shows up on our computer system. There's 14 exam rooms.
Wow.
Oh my gosh.
Yeah, it's huge. So there's like a little consult room for people to get checked in.
Sure.
This is a larger
First,
room for wheelchair access.
So how many physicians currently?
There's just me and one other physician, and there's 2 nurse practitioners, so
Okay.
4 providers. And I'm actually trying to hire 2 to 3 additional providers. And I think it also means for the provider giving up a little bit of control, because they really have to listen to their medical assistant or their LPN to tell them where to go, and have them manage their half day of seeing patients. So we'll have a psychiatrist here a half day a week who will be able to see patients for medication consultations, and will also be a resource for us.
Okay, great.